Toronto's new medical officer of health is laying out her roadmap 1 month into her new role leading Canada's largest local public health agency. Joining us now on BT, Dr. Michelle Murti. Good morning.
Good morning. Thanks for having me.
A pleasure to have you in studio this morning.
Thank you so much.
You're 1 month into this role. What do you view right now as the biggest threat to public health today, and how do you plan to address it?
Oh, that's a great question. Yeah, it's been a really whirlwind month of getting to know our whole staff across the city, as well as our city partners. And you know, I think it's hard to think about threats right now when the mood has really been so optimistic in meeting all of the wonderful people that I get to work with. It's just been really lovely to see, you know, how much enthusiasm in the city there is for rebuilding some of the social programming that we've had maybe hasn't been as active in the last few years because of the COVID pandemic. And that really is my main priority right now, is bringing back the promotion part to health promotion. We've been doing a really good job of protecting people's health in Toronto. We all know what a great job Toronto's public health did during the pandemic, delivering vaccines. But now we have to get back to things like healthy moms and babies, healthy schools, making sure that we can address things like affordability in the city through school nutrition programs.
Picking up on your note about promoting the promotion part of public health, I want to ask you, because the measles outbreak in Ontario, it's now officially over, but it did highlight, waning vaccination rates. And I wonder at a local level if, vaccination rates, not just for measles, but as a whole, for vaccines as a whole, are they declining? Is there any concern around that?
It's a great question, and we are doing a lot of work, and I think I put that in the same category as that promotion work, because what a lot of our job is to do is to make sure that we have the records to know which kids in the city have been vaccinated or not. And by and large, we think most kids have been vaccinated, but the process to get all that information can be a little cumbersome, and we certainly know that it was disrupted during that pandemic time. So right now, we're focusing on kids in grades 2 to grade 5 to make sure that we have all of their records, to make sure that maybe they've had that missed opportunity. My own daughter's in grade 4, so I know what a chaotic time that was when she was due for her shots between that 4 to 6-year-old age time, because she was sort of right in that middle of that pandemic. So it was a difficult time, and maybe parents got their shots, maybe they didn't, maybe they just forgot to upload them to the records. So that's the work that we're doing this year, is to clean that up, make sure people have been reminded that they were supposed to have gotten their shots at the time if they didn't, and to be able to offer to those vaccines if they haven't had the opportunity.
Just given some of the rhetoric that we're hearing south of the border, do you have any concerns about vaccine hesitancy here, and how do you plan to meet that challenge?
We know that misinformation around vaccines is a really big problem, that people have heard a lot of different information. It's getting harder to maybe distill that what is credible information and what is not when you're getting so much different information. And that is a really big focus for us right now, is to make sure that we understand how to give concise and accurate information to the public, and to help people with that kind of critical thinking to be able to identify, is something misinformation or is it not? And to be able to look for those credible sources to be able to identify that.
In many ways, as the leader of Canada's largest public health agency, or local public health agency, I should say, you're broadly responsible for the well-being of the entire city of Toronto. How do you think you should be held accountable?
I think, you would think about any other physician-patient relationship. So, if you were a patient and you're coming to your physician, you want to have a relationship between the two of you. And sometimes it takes time to build that relationship. The physician needs to get to know you as a patient, you need to get to know them, and you build that over time. And the more that you work together, the more that actually becomes, hopefully a really fruitful relationship where people understand you, we understand your bigger context, I get to know your family, I get to know, where do you work, what do you do? And I think it's the same for working with the city. It's going to sometimes take a little bit of time to really understand each other, to be able to work together. But I think that starting from that place of we have a mutual understanding and respect, and that we need to work together to make Toronto as healthy as possible.
Okay, Dr. Michelle Murti, it's such a pleasure to meet you. Thanks so much for coming in this morning. I have to leave it there.
Thank you so much.